My name is Shannon Cogdell. I'm a program director at Penn Foundation. I run our BCares program and our warm handoff programs, which are embedded programs that operate in an inpatient hospital and emergency room setting, providing drug and alcohol intervention and resources for people struggling with substance use disorders. We cover Bucks and Montgomery counties. We have 5 hospitals we contract with, and we are a lifeline for people that are struggling, kind of pre-contemplative patients seeking drug and alcohol care. So we currently have a team of 9 professionals. They are a mix of certified recovery specialists and certified family recovery specialists, as well as a bachelor's level clinician that are working with their lived experience to provide that hope and support and intervention for people that are still struggling and they're maybe new to the concept of recovery or not ready or not willing to access recovery services. And what's special about our team is that they've all lived this either through their own experience or the experience of a loved one. And they're able to provide that really peer-based, empathetic support they might not get in a different venue. That means that I have lived experience through a family member of my own that struggled with substance use disorder, and living that experience of what it's like to be impacted by someone else's disease and going along the recovery process with them. And a lot of times that also includes the relapse and struggling to stay in recovery or dropping in and out of recovery and building resiliency and being a healthy family member of someone who's struggled and using that experience to help other families when they're most vulnerable. So we have 2 ways to access care. The first would be our typical drug and alcohol process for people that are routine or able to go through the assessment process. That would be our open access, which is available Monday through Friday, 8 to 4 p.m., and that's coordinated through the admissions department here. The phone number for that is 215-257-6553. Our admission staff will conduct a screening, and the screening team will work to connect to the assessment team. And from there, we'll get the person scheduled. The level of care assessment will be conducted to determine the best treatment for the patient's needs, and there'll be a collaborative partnership between the patient and the clinician to determine what's best for them. For people that are emergent or urgent or really struggling, maybe through the middle of the night or after hours, they're welcome to visit a 24-hour assessment site. There's one in Bucks County in Bristol, or they're welcome to present to a hospital if they feel the need to do so based on their medical condition, and a medical provider will make a referral to the BCares team to meet with them face-to-face and provide that customized treatment plan to get them into the next steps of recovery. So in my time at Penn Foundation, I've really been able to get my own definition and idea of what recovery is, and a big part of that is providing empathetic care and harm reduction strategies for people that may be not ready to enter recovery, and supporting people no matter where they are in their recovery journey. We know that substance use disorder is a relapsing disease, and that relapse is often a part of the treatment and responding to that appropriately, and that there is no one-size-fits-all treatment. What's recovery for one person might be different for the other, and it's a very intimate and individualized decision. And whatever recovery looks like for you, we are glad that you're being courageous and brave enough to take the next steps to get there.